Good afternoon. I'm Dr. Ann Jarris, the Chief Executive Officer of Discovery Health MD, and we're going to talk today about strategies for returning to work during COVID-19. Summer has just started and we've started opening up. I know people have a lot of questions and things have changed a lot in the past couple months. So we're going to talk a little bit about today. We're going to talk today a little bit about what's different, what's new, and what we think our next path forward is. So what's currently going on right now? Many states have opened back up, have eased restrictions, and as you all know, many states are seeing a resurgence of disease. One question you may be asking is, why aren't these states going back on lockdown? Some of them may have to consider that, but let's take a minute and think about what's different between now and in March. The big things that have changed, if you think back to what life looked like in March, we really didn't understand this disease very well. We didn't have good treatment options, we didn't know how to treat it, and we didn't have good personal protective equipment. So hospitals were strained to the max during the initial outbreak, not only because of the number of patients who were sick, but just because of the sheer energy it was taking to protect providers and to figure out how to treat people. So even though our hospitals are nearing capacity in some of these regions, we're starting to manage it better. We know we can protect our providers, we can give them adequate face masks and protection. We understand how to manage patients who are potentially sick. We can identify them better because we have good testing. And then when people are in the hospital, we have a much better idea of how to treat people. So it's eliminated a lot of that confusion. So right now we're in a state where in many regions, especially in the South and the Southwest, our hospital systems are becoming strained, but they're managing. However, that's not going to last for very long. So I would expect in the next few weeks to start to see more restrictions being implemented in those states that have regional spread. Why are these areas having outbreaks? There's been a lot going on socially in the past month, but what people are finding is that the spread is mostly fueled by close contact. Being outdoors appears to be protective, and we'll talk a lot about that more in terms of the workplace. But the mass protests and people being outside don't seem to be the cause of this uptick in cases. It seems more to have come from family Memorial Day celebrations, people being inside and in close contact with other family members. We're really starting to find what the risks are for transmission and what you can do to protect yourself. So what do we know about the disease today that we didn't know in the past few months? Well, we know that a lot of people have it but don't have symptoms. We very clearly demonstrated that you can be infected, you can transmit it to other people, and you may not have any symptoms. Because of this, we're finding that the death rate is lower than we initially thought. But we're also finding is the death rate is not the most important metric here, that survivors are having prolonged issues with side effects from the disease. So it's not enough to just survive COVID. The question is, what does this mean long-term? And we don't fully understand that. We don't really fully understand the long-term health effects on the lungs or kidneys of survivors. But this is going to become very important in the next few years to understand that. So it's still very important that even though you may be asymptomatic or have mild symptoms, the COVID may not kill you. It can cause some serious long-term health issues, and it's very important to continue to be vigilant to avoid infection. So what about treatment? What about immunity, and what's the landscape look like for vaccines? We still don't have a good treatment against the disease itself. There's a lot of research going on to look at various drugs and how the virus works and what drugs we can use to prevent the virus from replicating or infecting a host, but we still don't have a good drug for that. We've learned a lot about supportive treatment, how to prevent blood clots, how to prevent inflammation, and those have made great strides in improving mortality, but it's still, we don't have a good way to treat the disease itself. Immunity, we still don't have a good understanding of that too. The antibody testing that's been done is showing that people do develop antibodies, but maybe not everyone, maybe only 6 to 80%. And those antibodies may not stick around for very long. They may only stick around for a few months. There are other methods of immunity in the body besides antibody production. So there are other ways that people could have immunity that we're starting to learn, but we still don't understand that. At this point, we still can't tell you if you'd be immune from reinfection or safe to return to the workplace based on antibody testing. We just don't know that yet. And vaccine, unfortunately, we still don't know about that yet either. There's a lot of research going on there, but we're not going to have a good understanding of that, at least until the end of the year or next year, as to whether or not there will be a good, safe, effective vaccine out there. So unfortunately, that doesn't put us in a very good position. We do understand how this disease is transmitted. If you'll remember a few months ago, we were very worried about surface transmission. We found that that's less of an issue. The biggest issue right now is that we understand that this disease is spread by respiratory aerosols and droplets. So what this means is that anytime you do something that generates droplets or aerosols in the air, whether that's speaking or forceful speaking or singing or even just talking loud or yelling, let alone something like sneezing or coughing, you expel a lot of these infectious droplets into the air, and they can travel a long ways. That's the reason behind masking. If you put a mask on, you stop these droplets and aerosols from getting into the air, and they can't travel as far and infect other people. Likewise, if you're in an area that has good ventilation, your aerosols aren't going to stick around for very long. They're going to get blown away by the wind or by ventilation and not have a chance to infect somebody else. The virus still can live on surfaces, we know that, and you still need to be good about disinfecting, but we think that that's less of a cause of transmission. And we know that people that live together or that work close together tend to get infected. So it's very difficult if you are living with somebody who has COVID, it's very difficult to protect against that. And that's important to remember when you're returning people to the workplace who live with other people that are high risk exposure for COVID. So the take-home message is that right now for summer, keep wearing a mask. You should also wear some form of eye protection. We believe that you can get infected through the eyes. So for regular contact, just regular glasses even help. But for workplace, if you're in a high risk area, you may need glasses that have side protection or goggles or a face shield. We know you need to stay at least 6 feet away from people, maybe further. Try and stay outside and in areas of good ventilation. Keep using your hand sanitizer and washing your hands. And if you do all of this, and if it just becomes your habit, then you're much less likely to become infected. So how are you supposed to go back to work? We've learned some things over the past few months, and we do have recommendations on a few safe ways to go back to work, but it depends what your work environment looks like. So we've started to talk about 2 different types of work environment, closed systems and open systems. So a closed system is a work environment where people can make sure that they're not sick before they enter it. They can do a 14-day period of observation with testing to make sure that they're not infected. And then when they enter the work environment, there's no new contact, that new people aren't coming in. But that's a very small part of the workforce. The vast majority of people work in open systems. This is where somebody may commute from home, or there may be shift workers, or you may not work with the same people each day. And that's much more difficult. That's going to require a much different approach. When we talk about approaches for open systems, which we'll talk about here, we need to think about how are people behaving when they're not at work? What are their risk factors for exposure when they're not at work? And then how do we manage the workplace to reduce exposure? And how do we manage the workplace if there is a positive test in order to make sure that we're identifying people? So this last point on this slide, screening, surveillance, testing, isolation, contact tracing, and quarantine. We're going to repeat that over and over and over again. That is going to be the core of our return to work strategies for open systems. So this is your future for the next few months. We're going to have to talk about employee behaviors in their off time. How do we screen employees when they come to work? How do we do surveillance of employees for infection, whether that's fever or symptom surveillance or testing surveillance? How do we incorporate testing into the workplace? If you identify a positive case, how do you isolate them? How do you identify their close contacts? How do you quarantine their close contacts and start all over and repeat again? So this is going to be really, really boring. And somebody said, you know, if this were a movie, this is the part of the movie that would be a montage. But this is what we have to live through for the next few months at least. So back to closed systems. If you work in a workplace where employees can do a 14-day period of observation before going to work and have testing, and then enter an environment with no new exposure, it's very easy to keep disease out. Examples of these type of workplaces would be fish processing vessels, blue water vessels, remote processing plants, offshore oil rigs, or remote work sites. It's very important that once you get the employees to the work site, that anyone entering it or having interaction with it is screened as well. So for closed systems, our current recommendation is a 14-day period of either a monitored observation or home self-observation. The employee should restrict all contact with anybody outside of their quarantine area. They should do at least once or twice daily temperature monitoring and symptom screening. And then at the end of this, we're recommending testing. We have found that there are about 2% of people who do this process don't develop symptoms, but still are positive for the disease at the end of this 14-day period. So testing has a role in this, at least at the end. There may be a role for testing multiple times during this process. There may be a role for antibody testing at the beginning and end of this process. Back in May, we went through this with about 520 workers. We did PCR and antibody testing at the beginning and end of a 14-day monitored observation period. And 6 weeks later, we screened about 25% of that population with PCR and antibody testing and found no new cases and no evidence that anybody had converted, so no evidence of exposure to the disease. So we feel very confident that our recommendations for closed systems are reasonable and are effective. Open systems, though, are a completely different situation, and we're all still learning about this. So this is workplaces where employees may commute from home or commute from a local community. These are workplaces where you can't prevent ongoing potential exposures. Customers may be coming in, vendors may be coming in, shifts may be changing. These are going to take a different approach. And we're starting to categorize these workplaces into low, medium, and high risk work sites. So this depends on what's the consequence of disease being introduced. If there's a work site that's in a medically remote place, we're going to be more conservative. What is the current state of the region where people work? If there's a big outbreak locally, we're going to be more conservative with our recommendations. What's the ability to put controls into the workplace to distance people? If you have a workplace where you simply can't keep people separate, we're going to be more conservative in our recommendations. So each risk category is going to require a different approach. And it's going to be incumbent on employers to look at their work environments and start to make some decisions about how they physically move their workers. So here's one approach for open system workplaces. And this involves the concept of podding or cohorting your workforce. Looking at how the employees in your workplace interact with each other, and can you group them? Can you group shifts together? Can you physically group people together? Can you look at how people move through the work site and limit their interactions with each other? This is going to make it a lot easier if you have a positive case to contain it. So looking at putting your workers together into these pods, ideally the pods would be about 10 to 30 people, staggering start times, staggering breaks, minimizing those interactions, looking at how employees flow through the workplace and minimizing areas where people would cross each other. Unfortunately, it means eliminating a lot of the common areas, break rooms and common congregating rooms where pods would have potential cross exposure to each other. We talk a lot about engineering controls. These are barriers that you can put in the workplace, whether these are physical plastic barriers between work sites or moving people 6 feet apart. You're going to have to look at your floor plans and decide how people flow through your workplace and how you keep them separate. And then one big issue that's going to be difficult is setting expectations for behavior. It's difficult to control employees on their off time, and making recommendations and setting expectations for how employees should be behaving in their off time is going to be important but challenging. People need to be very vigilant about social distancing, about masking and wearing eye protection, hand and cough hygiene, and disinfecting surfaces. If you do everything you can to ensure a safe workplace and your workers are not following these recommendations at home, it becomes very difficult to prevent the introduction of disease into the workplace. So many employers are going to have to look at how do I mitigate the consequence of disease in the workplace. So screening is one way to try and identify if there's a problem cropping up. Everybody by now is pretty well aware of the idea of temperature screening when people arrive to the workplace. So figuring out the best way operationally to do this, whether you actually have somebody there taking temperatures, whether you encourage employees to self-report, deciding what your temperature cutoff is for screening. The CDC currently still recommends 100.4 degrees Fahrenheit. Some other guidance may recommend a lower cutoff, like 99.6 degrees Fahrenheit for fever. a lot of that depends on the risk of the environment. If you're a fairly low risk environment in an urban center, you may have a higher tolerance for a higher temperature cutoff. And then asking people about symptoms. And as we know, the symptoms of COVID are varied and are changing. Currently looking for fever and cough, fatigue or muscle aches, shortness of breath, loss of smell or taste, headaches, nausea, vomiting, diarrhea, and other respiratory symptoms like sore throats. Those are the questions you're going to want to be asking people and ask them to self-report every day. If an employee does have a fever or reports new illness, they should either be sent for medical assessment or sent home. And one important thing to remember is if they do have symptoms, testing will not allow them to come back to work immediately. We'll have to talk about that more, really what the role of testing is for symptomatic employees. It's important to keep in mind that anybody who's doing the screening should be protected, so screeners should be wearing at least a mask, eye protection, and gloves. Surveillance refers to surveillance for the presence of disease or the development of disease. And this is beyond the initial screening. Screening is when an employee reports to work, you want to make sure that they're healthy to work. Surveillance is how are things going when the days that you're not working, how are things going throughout the day. And this is asking your employees to really keep an eye on their own personal health. Employees should be keeping their daily records. They should be checking their temperature once or twice a day. Temperatures are generally higher in the evening. It's probably better to ask them to check their temperatures in the evening. They don't necessarily need to write it down. You don't necessarily need to keep these records, but you certainly should ask employees to report if they do develop a fever or symptoms. And again, if an employee reports that, they should be asked to stay home and referred to a medical provider for testing. So testing right now is a mixed bag. It depends on where you live. There are significant regional differences in the access to tests and what tests are preferred. Right now, nasal swabs are probably the most common in the Northwest. Oral swabs are used as well. In areas that had later outbreaks, we're seeing more saliva tests being used. And then in very rural communities, some point of care tests are being used where they can have results within 15 minutes or an hour. There are some tests out there called antigen tests that look for proteins on the virus. These are not currently recommended. They generally don't have a good enough performance profile to be considered a sensitive enough test. And then what to do with serology or antibody testing. That is certainly not known well right now. So there's no real role for a single antibody test in return to work yet. So what you do for testing is going to depend on what you have access to. The difference in supplies, can you get test kits? Do your laboratories have capacity to do testing? How quickly can they get test results to you? That's going to determine what kind of testing you incorporate into your return to work strategy and your ongoing surveillance strategy. And that's going to change over the summer. So if you can do it, if you do have access to testing, the CDC is starting to come out with some recommendations. So the question is, if nobody has symptoms, does anybody have the disease? And that we clearly know that plenty of people have the disease without showing symptoms. So surveillance of fever and symptom reporting is just not enough. In a high-risk environment, you may want to consider routine testing of your workforce. And the CDC gave some guidance recently that talks about the frequency of how often you do this, and they suggest perhaps weekly. So we know that it may take 14 days for somebody to show illness, and we know that the PCR tests are generally positive on days 1 through 5 of the illness. So weekly testing, you still can miss people, but it is a reasonable frequency to start at. Some healthcare environments were testing daily, some were testing every 2 days or every 3 days. But for a general critical infrastructure or high-risk workforce, PCR testing weekly might be a good place to start. And as we do more testing and learn more about this, we'll make recommendations. There's something called batch testing or pooled testing that people have heard about. That's where you have a group of people who give a sample. So your pod or your cohort would all spit into a cup and you would run that sample. It would give you an all negative test, means that nobody in that cohort had the disease. But if you do get a positive, you have to go back and individually test the cohort. So that is one option that may start to become more recommended in order to rapidly screen a workforce. But right now, individual PCR would be recommended, either a nasal swab, oral swab, or a saliva test, depending on where you are and the availability of it. If you don't have good access to testing, testing will still be reserved then for a worker with fever or symptoms, or close contact of a confirmed or suspected case. So what do you do with a positive worker? Somebody turns positive, obviously they shouldn't come to work. That worker should be put in their isolation. So isolation is what you do if somebody has the disease. This is where you would separate a sick person so that they couldn't infect others for a period of time until they were no longer infectious. Problem is we don't really understand how long people are infectious for. Our best guess is about 8 days, which is why the CDC recommends 10 days after a positive test. So return to work strategies vary. And again, the recommendations vary on the risk of the work environment. If it's a low risk work environment, then one of the CDC strategies is appropriate. If it's a very high risk work environment where sending a potentially infectious worker back could have catastrophic consequences, then you might want to wait a little bit longer. So the CDC gives you 3 different options for return to work. A time-based strategy: if people never had any symptoms, you should wait 10 days after that positive test. A symptom-based strategy: if people did have symptoms, there's a certain recommendations for amount of time with no symptoms and amount of time after the symptoms started before people go back to work. And then a test-based strategy where people would have a negative PCR test, at least 2 negative PCR tests at least 24 hours apart from each other before coming back to work. So what test strategy you use for return to work depends on whether or not the person has symptoms, and depends on the availability of testing, and depends on your risk threshold. This is the fun part: contact tracing. I can't think of anything more exciting than this. And there's been nothing more fun than trying to trace contacts back across multiple shifts. When somebody finds that they've had a positive test or a positive exposure 2 or 3 weeks ago, having to go through shift after shift to figure out who was within 6 feet for 15 minutes is really, it's a fun project for quarantine. So my recommendation is you do everything you can to make this job easy. And this involves podding or cohorting the workforce. So if somebody comes to you and says their test was positive, or they were a close contact of somebody with a positive test, you need to start figuring out who they might have exposed. And it's not just since they had symptoms. We know people are infectious before they have symptoms. So you have to figure out who was exposed to that person for 48 hours prior to them developing symptoms or getting a positive test. And how do you define close contact? The CDC, it says, being within 6 feet of somebody for 15 minutes, or having had contact with infectious secretions. So now you got to figure out who was 6 feet away from this person, how long were they 6 feet away from this person. It's a lot of detective work. So if you can pod your workforce into 10 to 30 people and just say, these are the people you most likely had close contact with, it's just going to make your life a lot easier. So those close contacts need to be quarantined. So isolation is for people who have the disease. Quarantine is for people who had close contact with someone with the disease. And the idea is that if you had close contact with a sick person, you need to wait 14 days to see if you get sick. You can't shorten that. It takes up to 14 days to incubate and become infected with this disease. Now, the second problem is, since we know people will be infected and not have symptoms, it's a good idea to add testing onto this. So 14 days with no fever and no symptoms. If you can do it, I would add a PCR test onto the end of quarantine to make sure that somebody is not asymptomatic and still infectious. Now, what can this person do during this 14 days? Well, they shouldn't be at work. They shouldn't be having close contact with anybody else. If they live at home with a lot of people, those people need to understand that they are potentially at risk for being exposed, and maybe you need to find a different quarantine location for the person. They should be checking their temperature twice daily and monitoring for symptoms. And if they have fever or symptoms, they should seek medical care. So this is the other problem. It's not just you wait 14 days and you're good to go. You're spending this 14 days waiting to see if you get sick. And if you get sick, you're not good to go. If you get sick, you need to see a doctor and you need to be tested. If it looks like you have it, then you need to be isolated. So you could be on day 14 of your quarantine and develop fever and get tested, and now you have 10 days of isolation in front of you. Public health should be involved in all these processes. Your local public health agencies are getting very used to doing this. So certainly involve your county or your state public health in all of these processes. And then pods. So once you've podded your workforce, this is where you might want to talk about doing surveillance testing. If you had somebody who had a positive test but no definite close contacts, you could consider testing the pod. If you just aren't sure, the CDC gives a couple recommendations for high-risk workforces on how you could test the pod. They suggest testing it every 3 days to see if someone turns positive. They do give some recommendations on what you can do during that time. Other recommendations for testing an exposed pod would be maybe testing daily on days 3 through 8 after the exposure. This might be a higher yield time for finding a positive test. But in reality, we don't really know. So in reality, the ideal study would be to test your pod daily on days 1 through 14 after an exposure and figure out when the true high yield testing days are. So hopefully that study will happen at some point in time and we can gain some better understanding on what the appropriate testing frequency is for close contacts or pods. So in summary, there is a way forward, but it's going to be really boring. And I'm sorry about that, but that's just our lives right now. If we can do basic precautions, if we can mask, wear eye protection, and stay 6 feet away from each other, and do hand and cough hygiene, and disinfect things, and sit outside rather than inside, and make sure our inside ventilation is good, we greatly reduce the risk of infection. So we can go back to a sense of normalcy, but we're going to have to do these basic hygiene precautions. If we rethink our workforce, if we rethink in terms of barriers and flow and how we keep 6 feet apart and minimize exposure, then we can manage the risk and we can send people back to work. But the key now is to stay vigilant when people develop symptoms, make sure that they get tested and that they get isolated. Make sure that you do your contact tracing and quarantine and accept that this is the way your summer is going to go. So thank you for your time. If you have any questions or want to talk about how to return your workforce back to work safely, please don't hesitate to reach out to us. Thank you.